what exactly has been tagged to your name. So go out there today, look for something that you will create, look for something that you will invent, and let people say, oh, this person actually did this. And then you go viral. You know, in the Western world, when they see people with such talents, they pick them very fast, and they train them, they invest massively in those talents, you know. So please, go out there, look for something to invent, look for something to create, so that you will be remembered for good when you are gone. All right, we also have the National Aviation Day. National Aviation Day is celebrated today. We feel the need for speed on Aviation Day. And then we have the National Patient Advocacy Day. National Patient Advocacy Day. Now, we notice and appreciate the medical professionals that advocate for their patients. Now, this brings me to the medical practitioners, the medical sphere. There are some medical practitioners that actually speak out for their patients. They feel what their patients are going through. They put themselves in the shoes of their patients. They are the real hero. But there are some, when you get to the hospital, the way they talk down at you, the way they yell at you, like it's your fault or your making that you're sick and you're in the hospital. I just wish the medical, the board management can actually fish those people out. Because when a person is sick, the person comes to the hospital not just for you to care for the person, but for you to talk life into the person. Someone comes to the hospital with a high BP and you talk to the person like the person does, as in the person is not even a human. Tell me how would that BP go? The BP will increase. I have been in the hospital and I see pregnant women that are in pain. They are in excruciating pain. And you see these midwives or these nurses or doctors, female doctors for that matter, they shout at you. Am I the one that impregnated you? Please stop shouting. There are other people here. Is this your first child? As in, the way you talk to them, I don't understand. Sometimes I just feel like going there and giving you a smack on your face. This is a woman trying to bring another human being to life. You know how painful it is. And then you yell at the person, you shout at the person, you do so many things. Some even let the patient sit all by themselves, you know, no bed, no medication. Some will tell you, if you don't deposit, I will not treat you. Oh, God, no. Now you see that there is actually celebration in helping people, in advocating for patients in the hospital. So please, our medical practitioners, this is particularly going to you. In that office where you are not God. You are human. Any sick patient that comes to your office or that comes to the hospital, treat them with love, treat them with care. That is what they need. If they can stay in their houses and get treated, I bet you they would not even want anything to do with coming to the hospital. Like myself, I don't like going to the hospital. I don't like it because I wouldn't want any doctor or nurse to shout at me or talk down at me, even when I am ill. I better stay in my house and you come and administer the treatment in my house. So please, on this day, we are appreciating the medical practitioners or the medical professionals that advocate for their patients. Advocate for their patients. Not talk down on their patients. That advocate for their patient. And I celebrate you today. I know that there are so many medical professionals out there that are on this line, that are good, that are nice, that has conscience. And this day I am taking it to celebrate you. Kudos to you. Keep doing the good work that you're doing.
Right, that's a good one because I was actually listening to all that you've been saying concerning the need for the medics